Right, good morning. It is good to see you on this beautiful Tuesday. I trust that you're well. Thank you very much for joining us on My Doctor. My name is Winnie Lubembe. Now, I'm pretty sure you've seen some of the people with white patches on their skin, and most of the time we don't really understand what's going on or what the condition is all about. Well, you want to stick around till the end of the show today because that will be our subject of discussion, and that is on vitiligo. So if you have any question in relation to the same, then feel free to call us live. Or 791-478-990 is the number to call in, or alternatively, if you wish to send us a text message, then do so on 40920 with your name and of course your question, and we'll answer them as soon as we get it. So without further ado, let me introduce the video for today, and of course we'll be right back with many or so much on the discussion. So like I said, you want to stick around till the end of the show. My guest is here, but before you meet him, take a look at this video on vitiligo. All right, that's pretty much what we'll be talking about today on our show, and that is vitiligo. And like I said, if you have any question in relation to the same, then feel free to call us live or 791-478-990 if you are living with this condition and probably experiencing some sort of stigma, because yes, there's a lot of stigma associated with the same, and you'd like to share your story, then feel free as well to call us live. And yes, the number is 0791-478-990. Alternatively, if you have a question, then also call us live, or alternatively, send us a text message on 40920 with your name, and of course, we'll answer your question as soon as we get it. A lot of big terms from that video, and that is on melanocytes and all that. So don't worry, our doctor is here ready to answer all your questions associated to the same. So let's meet him. Good morning.
Good morning, Winnie.
It's good to see you once again. How have you been since you were last here?
Oh, it's been good.
It's been good?
Yes.
All right. And we're glad that you've made time for us today. So before we get into everything vitiligo, kindly introduce yourself.
Oh, thank you very much. My name is Geoffrey Ngewa. I'm so glad to be here today also for this show. Yeah. And I am ready for the show.
All right. Okay. Yes. And let's just start with the basics, because like I said, we see people with this condition every single day, I would say. And most of the time, some people don't really understand what the condition is all about. And I remember we were discussing this before we came live, and that is, you know, some people used to associate this with witchcraft, or someone did this and then somebody decided to take them to Ganga or something. And so people don't really understand what vitiligo is all about. How does it come about? Is it contagious? So many questions associated with the same. So can we just go back to the basics, just in case someone tuning in right now thinking, okay, what exactly is that?
Okay. Winnie, vitiligo, vitiligo is a skin condition, as we have just seen on the video. Vitiligo is a skin condition that manifests in the distribution of non-pigmented patches on the skin.
All right.
Yes. And it is actually not, as you have said, it's not really out of the wagangas and whatever, but it has a medical basis. An explanation can come out medically, and that is actually as a result of the melanocytes. Melanocytes are the cells that are on the base of the skin. Okay. So those are the cells that are responsible in producing melanin. Melanin is the pigmenting factor of the skin. So we have the white and also the black. So it affects both.
Both races.
The races, the white and the black too. So actually, vitiligo now comes in to when the melanocytes don't function. Okay. So lack of that color, the pigmentation, is what now is the vitiligo. Yes.
Okay. And from the video, of course, they said that there's not known cause, you know, for the same, but of course there are triggers, and I think we'll talk about the triggers later on. But then again, so how does it start, and who gets affected? Because we see, of course, different people, you know, with the same. It doesn't choose gender. So who, or let's just start with who, or how does vitiligo start? And then we'll also talk a little bit later on who is more at risk of getting vitiligo.
Yes. Vitiligo starts. It affects the age of way up to 20 years, and also between 20 and 30 years, many a times. But it can affect anyone. Anyone can get. So vitiligo actually is as a result of the mainly the autoimmune reactions where the body actually, I can say mistakenly begins fighting against itself.
Okay, all right.
So the melanocytes, they are affected. Those are the cells that are responsible in melanin production.
Okay.
And also now, the autoimmune is just an aspect. And then, or you can also get some other infection. Sometimes it might be a viral. The virus, they come and then they, it attacks, then it kills the cell.
Yeah.
So it's possible. We also have other causes that indeed accompany, beginning with also the photo effects, because sometimes, yes, the photo effects, because you will realize that it affects mainly the parts of the body that are exposed. Yes, the face, the hands. So vitiligo comes in when the melanocytes have been prevented, have been affected rather. And you realize also sometimes when out of the jewelry that we put on, the jewelry, and also the metallic objects, the compressions, those are just the triggering factors. Because you see, anything that can lead to these cells from, it can prevent the cells from functioning, right? Or it inhibits their functions. That one, it causes. And also another factor that I may not have mentioned is genetic. Because the melanocytes, they have some genes, specific genes, that always sit on them. So those genes are responsible for the color.
Okay.
And so once there is a problem or deformation on that segment of the gene, then definitely you will end up with that condition.
Okay. All right. And something else from the video which really nearly shocked me is the aspect of friction from certain fabrics. How is that possible? I don't understand. So how does that sort of trigger or catalyzes the onset of vitiligo?
As you have seen, we have the nerves also on the body.
True.
And the nerves are responsible for tapping the sensations. So once it irritates, the sensations are, they are propagated all the way to the centers.
Yeah.
And then also, out of the same, there is compression. But these are just the ripple effects. The ripple effects come and affect the melanocytes now, the cells under the skin. So you realize that it's generally as a result of the trauma that has been caused. The trauma actually, and the end result is the inhibiting of the function of the melanocytes.
Okay.
And so that is basically how it ends up, this fabric. So you also have to take care of it. If at all, you have to take care of the fabric you put on, if at all you've realized such signs.
So are there some of the specific fabrics that probably are known that we should know about and sort of avoid, or if not, then be mindful that this, of course, might trigger not necessarily vitiligo, but of course might end up, causing friction and trauma again on the nerves, and end up probably triggering vitiligo. So, can we have examples of these fabrics so that we're just conscious?
It is preferable you put on. But it is not actually that, that is not the main cause setting.
Yes.
It's not the causing factor.
Yes.
But it's a triggering factor, especially when you have once, if you have been exposed to that condition. So these are the things that catalyze. So for people with vitiligo, the moment you realize that is because vitiligo also, depending with also how you'll manage, I know we might mention that ahead.
Later on, yes.
There are some drugs which you'll use, then they will also make your skin to be tender, the corticosteroids and all that, and also the therapeutic measures that can be applied. So when you apply such, you realize your skin becomes tender. So it's advisable that you use fluffy clothes.
Okay.
You can use cotton, smooth, anything that is rough, try to avoid.
To avoid it, okay.
It's good to avoid the moment you realize that's the triggering factor. Oh, yes.
All right, okay. Now, is it sort of related to albinism? Because, of course, when you notice the patches, they're more or less, you know, probably the same color as, let's say, a person living with albinism. So is it sort of related? Because we also talked about there's that, you know, hereditary aspect, you know, in relation to the same. So is it related or two totally different conditions?
Now, here comes the distinction. When you look at albinism, albinism is total. You realize the genetic factor, the genetic aspect is exalted.
Yeah.
Is paramount in this. On this other one, it's rare. It may not be the genetic aspect.
Okay.
So this one is not majorly hereditary. It's not mainly hereditary, but the albinism aspect, it's hereditary mostly.
Okay.
So, and on that note, they relate, yes, they relate by the virtue that the pigmentation of the skin is
more or less the same.
Yes. So that's how they relate.
Okay.
But then how they come and manifest and also management
Is different.
is different.
Okay.
Yes.
Okay. All right. Now, so we talked about the fact that, of course, the patchy areas can be a little bit tender. So is it itchy? Can it be painful? You know, so that just people understand. And if that is the case, why?
When you talk about vitiligo, vitiligo has no, let me mention this very important point, it has no direct medical implications.
Okay.
Someone can have vitiligo and they're very normal, they lead their lives normally. So it isn't really as directly. So as a result of that, vitiligo on the skin, the types of dressing, the types of material that you put on, like the dress or the clothing that you use, how it manifests, how it affects your skin isn't really specific.
Okay.
Yeah, so it is not really limited to it's not to everyone.
Okay.
But it's limited to specific. Those ones.
Okay.
And also mainly it usually comes and manifests in you know, in the management, the management procedures.
Okay.
Because mainly, you know, many people don't really accept to live with that. So when now you get to enroll the treatment and the management procedures, then your skin, there are many side effects.
Yeah.
There are actually side effects that even affect your moods.
True.
They affect, they affect your conditions, you know, other systems in the body. So that is how it goes.
Okay.
Oh, yes.
And you talked about the fact that, of course, exposure to also, you know, UV rays can also have, of course, an effect on your skin. And you know, typical Africans, this is what we always say. We have a lot of melanin. I mean, why wear sunscreen at the end of the day? So can we demystify this myth that, I mean, we have enough melanin, we do not have to protect our skin, we do not really need sunscreen, which, truth of the matter is, not many of us use sunscreen. I mean, people will be like, well, what's the point? We have enough melanin and our skin cannot be, you know, damaged by the UV rays. So can we demystify this myth? Oh,
yes. We really have to demystify this myth because at this moment, you know, melanocytes are in every race.
Okay.
Talk about the whites and now the Africans. Also we have, but they are black. The others are white.
Okay.
So that's why you'll see when it affects a white person, you will realize that there is some difference in the tone, the skin tone.
True.
There is difference. So the same way it comes, you know, it affects us. Yes, it is the black pigment, but we have to, it's not, we should not take it like we don't need the sunscreens and all that.
Yeah.
Yes, it's not to everyone, but the moment you realize it is affecting your skin, the moment you realize the effects are coming out, then please go on and use the screens, the sunscreens. Yes, use. Because the ultraviolet rays, they affect. Yes, when they are, you know, when you too much also, when it's too much concentration and the exposure, then it affects your cells. So it's better you take care of yourself.
Protect your skin.
Protect
All
your
right.
skin.
Okay.
Oh,
Now,
yes.
can we talk about the fact that there's some people who might be more at risk as compared to the others, you know, in terms of getting vitiligo? Who are some of this, let's say, groups of people who are more at risk, and not necessarily people, but some of the risk factors for the same?
Okay, people who are at risk of getting this, the age of up to 20 years, as I mentioned before, also between 20 years and 30
Okay.
years.
All right.
That is so common. The reason is also, you know, the stages of maturation. You realize these ones may not really have caught up into the system in a way or another.
Okay.
And also somehow their cells might be vulnerable because it doesn't apply to everyone. It applies to specific people who have been affected.
All right.
But still, these people, they are normal. That's where the weakness has just come in through. On the side, but the other ages, of course, the melanocytes must have grown and, you know, must have adapted, and they are very strong already in their stature. So everything, it is hard for them to catch, you know, to get these effects, especially from the sun, the UV rays and all that. Okay. So those are the people who mainly get affected by that condition. But still, the fact remains, everyone
can get it. Yes.
Anyone can get it.
All right. And what about people who work mostly in like industries, are exposed to you know, chemicals and all that? Are they also at risk of getting vitiligo?
Oh yes. Like if you work in an industry where there is chemical production, chemicals, we know chemicals have great effect. So like if it gets to your skin, they bring different, varying effects.
Yeah.
So if at all the effect will come to those cells on the body, then on your skin, definitely it will come. Okay. Yeah, it will come. However, that one, you know, there are types of vitiligo. There are those, there is the generalized, which you have it on both sides. So that one can also help in distinguishing the cause. And also the effect of the industries. But then there are those which are specific at one point, you see. So like if that's what we call the focal. I know we might come and talk about
yes, the types.
But the reason I've gotten to that is when you've asked about the chemical, that is the focal type is the most common, especially because it will only kill those cells which have been exposed. Maybe because of different causes, then now we can have these others.
All right. Okay. And then I think one of the questions that most people ask all the time is, one, is it contagious? And two, is it life-threatening? So can we start with the contagious and then go to whether it's life-threatening or not?
Vitiligo is not contagious. Vitiligo cannot be spread from a person to another. Secondly, vitiligo is not life-threatening.
All right.
That's just a condition that affects the pigmentation of the skin, which is somehow a parallel thing to the entire systems in the body. Not unless maybe it's another cause. Like for people with diabetes, where we have the thyroid effect. Now, like if the thyroid, sorry for that.
It's okay.
If the thyroid glands have been affected, like because of the diabetes, for example, and the production of these hormones here and there, you realize that is the condition. Whatever that has caused is what might affect or threaten your life.
All right.
But this one, vitiligo, is not contagious. It's not life-threatening. You will live your normal life.
All right. Okay. All right. Now, and we also talked about you know, the different type. You talked about focal, which is it the same as segmental and non-segmental? So can we differentiate those two types? And which is more common actually in the country?
The most common, we have the, you have just mentioned segmental. There is we have the focal, the segmental and the non-segmental.
Yeah.
The non-segmental is the rarest, most rare. It's
Okay.
very rare.
All right.
Because the non-segmental affects maybe only one side of the body. It's not really. The generalized, which is the segmental, is most common.
All right.
Yes,
All
the
right.
focal is also rare, but it happens just because of depending with what has really led to it.
Oh, okay.
Yes, especially the chemical exposure and
All right.
such.
Okay.
Oh, yes.
All right. So what differentiates segmental and non-segmental? Is it in terms of the appearance? Because sometimes you find people probably with a pigmented, let's say, skin on just one side, let's say, of the face. Or you'd find some people with, let's say, if it's the hands, it's both hands, where if it's on this other side and then on the other hand, it will also be on the other side. So is it different in terms of either the appearance or probably, from what you said, sometimes the cause?
The classification is based on the appearance,
All right.
mainly. And then the causes also are there, just
All right.
at the backdrop.
Okay.
Just behind it. So you realize the cause is what determines how it
All right.
manifests.
It can be segmental or non-segmental.
It can be segmental or not segmental. So when it appears on both sides, then the cause, that is part of what helps the doctors also to get to know the diagnosis of what exactly led to that, so that they can advise. But when you talk about focal, which is the focal is specific point, you'll realize some patches of lack of the pigmentation on the skin. You'll see the patches, but on a specific point. Then the segmental, you see, you'll get it on both sides.
On both sides.
And
All right.
the non-segmental, it comes on one side, right?
All right.
So
Okay.
it manifests in different ways based on the causes, and so that's how.
All right.
it comes.
Okay. Now, is it possible, or for vitiligo to affect the entire body? Do we have those cases? Because we rarely see them. But is there a possibility that, let's say, once someone has vitiligo, and of course you cannot really tell in terms of how the pigmentation comes about and how fast let's say they go, but is there a possibility that someone might have vitiligo on the entire part of the body? That is the universal type.
Let me address let me mention the points which are common
All right.
to the vitiligo. Vitiligo affects mainly, it manifests on the retina, that is the part of the eyes, and then also on the mucous membranes of the body. That can be the inner part of the nose and also the lips.
Okay.
You will always see it come. You'll also see it in the groins or the folds, especially the elbow, where there are folds, the skin folds. And actually, the melanocytes are in those areas. They're also in the heart.
Yeah.
In the heart.
It's interesting. Okay.
Yes, the melanocytes.
Yeah.
Those cells are everywhere. It can also come out in the groins. Yes. So it affects all body parts. It can begin from those areas, then it spreads.
And then it spreads. Okay.
Yes, and
All
also
right.
so it can appear on every,
on the whole body.
Yes,
Okay. So and the question is, so how does one differentiate now vitiligo that is universal, a type where of course the entire body is affected in terms of the pigmentation, and now albinism? But I think we'll talk about that after the very short break. So if you have any other question, you can see a number of questions, but keep sending them on 40920 with your name and of course the question, and we'll answer them as soon as we get them. And also, if you wish to call and ask your question directly to the doctor, then don't worry. You can also call us live. 0791478990 is the number to call in. So we still have a lot to discuss on vitiligo. Stay with us. We'll see you after the short break. Right, welcome back. Thank you very much for staying with us. This is My Doctor, just in case you're tuning in right now. Our focus is on vitiligo. And like we said, if you have any question, feel free to send us a text message on 40920, or alternatively, call us live. 0791-478-990 is the number to call in. And of course, we'll answer your questions as soon as we get them. We have Dr. George with us today, of course, to help us understand more on vitiligo. And talking about questions, we have a lot of questions for you. This one says, how can I prevent it? And then continues to say, because I'm having a dot and it's starting to spread.
Preventing it, if the dot has come out, it's called a macule. It begins with a small spot.
Right.
So preventing it is getting to, I will advise that you go to the physician so that they may be able to know what exactly has led to that. And from that level, you can use also cosmetics sometimes, and also because they will advise you, if at all, it will be the sun rays that will catalyze the spread. Then you will be advised on what to do. Also, if at all it's genetic or something, they will, the medic will take your history, and then based on your history, you'll be advised. But now this is how it comes. It comes in different ways. If at all it is best, you know, you might be diabetic or not, then we will have to manage that. So if at all the spot has come, also try to avoid the compressives, the compressing, the jewelry. Try to avoid in that place. Also try to avoid the light, you know, overexposure to light. And you can also try to avoid the rough texture clothes. So try to just avoid whatever those causes are. But when you go to your physician or your doctor, they will advise you very well, better, based on what they will have found to be the initiate.
Oh, right. Oh, yes. And I was about to ask you the same. So how do I know what caused it? Because we talked about that aspect of an autoimmune in a condition. And then there's also exposure to light and also, you know, fabrics and all that. So how do I know that probably this is the cause and I should sort of avoid? And so, yeah, so can we talk about the diagnosis? What happens so that, let's say, the medics find out that, oh, probably it's the let's say, the exposure to light, or probably it is the fabrics that I wear, or probably it's, you know, exposure to chemicals. So what happens during the diagnosis part?
During the diagnosis, the medic will take your history.
Right.
The history, the family history, because we will also have to identify and get to know if there are members of your family who have had the same condition before. So based on that, we might be able to know if it's a genetic cause.
Okay.
So if it's a genetic, then we'll get to identify. Also, if you are suffering from diabetes, as I mentioned, the thyroid gland effect. So, you know, the hormones produced in the body sometimes, and then you know that it might have brought the effect. Then the autoimmune will know exactly what is it that has caused the body to begin fighting against the melanocytes.
Yes.
So in the same way again, we will know, oh, so this is the cause, and try to help you manage it so that we prevent the spread if possible.
Okay.
By advising on how to go about it. So those are majorly the ones. And also if it is the focal one, if at all they are the chemicals that you have been exposed to, then we'll be able to know based on your past medical history and also your environment, you know, where you work, your family, and all that.
All right.
Yes.
And for this viewer's case, that dot. All right, and her question was, so how do I prevent it? I think can you stop it from spreading now that you have noticed, let's say, a patch, and you, of course, they're scared that what if it spreads? So is there a way that you can stop?
For many people, now, as I just mentioned, if you get to know it, what really catalyzes, yes, triggers it to spread.
Yeah.
somehow the management can be.
Okay.
But
All right.
in most cases,
You,
it spreads, it continues. Yeah, especially if you may not be able to figure out.
okay.
So
The cause.
yes.
Okay.
However, still your environment will, based on the number of factors that you are in, you know, that surround you, then you'll realize you will continue. You'll have it. But still, all the same, even if it continues, there is nothing much to worry.
Yeah.
You don't have to worry. You don't have to be worried that, oh, now this macule is going to grow and affect the entire body. You will get to know how to handle it.
Yeah.
But it's possible. It's possible based on what has really caused that to happen. It's possible to prevent it, to manage.
Yeah.
Oh, yes.
Okay. All right. And then we have two people asking about the treatment. One says, a milker asking about vitiligo. Is there a way of treating it? And then we also have another one says, da vitiligo ni gani? Juniko nayo inani stress sana. Naitwa Betty.
Yes. There is treatment. And the treatment is meant to maintain and, you know, try to also prevent the spread. It's possible to treat. We can use the corticosteroids.
All right.
Those are the drugs I'm sure you use. So then there are a number of drugs you use. We can also use the photochemical methods. But in treatment, there are side effects when you use this.
Okay.
So it disturbs. It really disturbs. Yes, but do not be shocked. You know, when you see those signs and the side effects when they come, the skin rash, when the erythema, sometimes it becomes red, and then sometimes your skin becomes very light and itchy because of the drugs that you use. However, we are different people. And based on the type of person you are, your physician can be able to, can advise you on which specific drug you can use.
Okay.
Because there are some which really don't augur well with you. So do not ignore and don't just go and buy drugs because you heard somewhere that,
yeah,
oh,
that
this is
someone
what
is using a
treats.
particular, okay.
Oh, yes.
All right.
Because it might have a negative impact, a negative effect to you.
Okay.
We also have other advanced because, of course, when you come, part of the diagnosis, we use what we call the Wood's lamp. Because with the Wood's lamp, we can be able to observe and see where what the eyes may not be able to see.
Yeah.
So with bare, bare eyes. So then we observe and then, we will get to know exactly what has brought this. And also, we can now recommend from that point, because there is also biopsy. I've just remembered part of the diagnosis. You can, when you come to the medic, then you can, or the dermatologist, then you'll get to know, oh, so this condition now, it's fit for us to take biopsy so that we may test and find out exactly what has caused it.
All right.
And based on that, we can also recommend, you can also be put under there is the advanced way of managing it using of the technology.
Right.
Yes.
Managing or treating? Managing.
Managing.
Okay.
But also somehow there is also there are some other measures of which the researchers are also working on it.
All right.
There are other measures like the melanocyte transplant.
Oh, okay.
So that's something which
that's
is
still
being
under
worked
research. Okay.
on. Yeah, so that's also a way of managing it and dealing with it, or treating it rather. So, what I'll advise is, the moment you've seen the signs and all that trying to come, when it's still a macule, a small spot, go see your doctor.
Okay.
And when you see the dermatologist, they'll be able to see, so that they will advise you accordingly. Though the latter is very expensive. They're very, very expensive. Yeah. So, yeah, you can treat, but sometimes it may not really. It's not. There is no treatment that is effective. 100%.
Okay. So it's treatable, but is it curable?
Oh. That is it now. You cannot cure it.
You cannot cure it.
You can only manage it. And in fact, there is what we call the muscle tone management. You try to just balancing the tone that comes in with the other you know, the other profession also comes in that assists to just balance out the tone. So it may not come out as perfect, yeah. But also some people I've seen, they also use makeup to maintain, you know, to try to. But then, you know, when it rains on you, then you see things will change.
There's a difference, yeah.
So there is the management, then when it comes to treatment. However, you should not be worried.
Okay.
Yes, because there are many people who have the same condition.
Yeah, and like we said, it's, I mean, you just lead a normal life. The only difference is that there's pigmentation on one's skin.
Oh, yes.
All right.
You lead a normal life.
All right. Okay. Now, we also have another question. This one says, I'm Joki, and I have it in my private part, and after sleeping with my husband, I feel the pain. Please help.
That is actually as a result of the irritation. The irritation, of course, because of the nerve supply, the nervous system, that point, the sensory endings, so nerve endings. Okay. So that could also be because, you know, the lights, that person could also be using the drugs I've just talked about. So because of that, the effects also come, they accompany. So if that is what happens, then you can see your doctor and consider also changing the type of drug you're using, if possible. Okay. And also you can opt not to use the drugs.
All right.
Yes, and like that.
Okay. All right. So it won't have an effect in terms of like spreading and probably causing at some point the universal type if someone stops their medication?
If you stop the medication, depending with, okay, if the universal type, if you want to prevent it from spreading, you'll continue using the drugs, but the repercussions, you know, the side effects, you'll not avoid them. Yeah. Yes, they accompany. Okay. It comes on both sides.
All right. And can we just talk about, you know, the treatment options and what exactly determines the kind of treatment one gets? Is it on the type or is it mostly on the course?
What determines the treatment that this person receives depends on the cause, because the cause really affects. If it's a viral infection, then no. We have to get, you can only treat something when, you know, you don't treat the signs and the symptoms, you treat the cause.
The cause, true.
So it's very important. Also, how it comes out may not really affect on the mode of treatment, of management. Yes, but the treatment is based on the cause. So if at all it's a general one, the generalized, then you have to if it's preventable, that is, then you can prevent. Of which also I mentioned something. It also comes, you know, the meninges. The meninges are layers of the brain, in the head. They also have the melanocytes. And so on the head you might also find some discoloration.
Yes, especially for the hair. And thank you for mentioning that, because I was about to ask, okay, because we've seen some people who have, let's say, patches on their hair, and the rest of the skin is okay. Or we see some people with, of course, the pigmentation on their skin, but the hair is okay. So how does this come about, really?
It happens depending on what has led to that.
Okay. And so for the hair, mostly what causes for the hair?
Many a times, if it's based on the nervous, the nervous system, especially within that dermatome, is what we call the dermatome. There are areas which are supplied by a specific nerve, also the blood supply and all that. So within that part, it might affect. Okay. So, like on the hair, it's possible that is the only part that has been affected. Okay. So it brings like I've seen also before at one point, there are people who have specific part of the head with that type. Yeah, so it's also an effect of vitiligo in a way.
Okay. And can you now, and especially for the hair, because I've seen, you know, a mother and the daughters, I think it was 2 daughters or 3, picture where they have vitiligo on just one part of the hair and just this part. So can you, let's say, now that you've noticed, let's say that patch on your hair, can you do something, let's say, to prevent, you know, it from spreading to now the rest of the body or even the rest of the head? You can
manage it. You can manage it. if you are not comfortable with that, then it's good you go for the treatment. And actually, I mentioned during our previous session, I work with Medisport Health Company. We also supply many of the cosmetics and all that. Apart from just the health management, like this health information that we are talking about, you can get in touch, and then you will be able to be supplied with whatever the cosmetics and all that, so that you can manage your condition. And also, there are those which cannot really spread. There are those which...
Oh, it's just on one side and that's
it's
it.
just on one side and that is it. So it's your doctor who will be who will help you, who will advise you if it will spread or not.
Or not.
So you don't have to worry.
Okay.
Go to your doctor.
Okay.
Be examined and be advised.
All right. And still on treatment, because I think so many people are asking about the same. So what do they use? Do they use creams? Do they use tabs? And then do you have to take it maybe for the rest of your life in terms of, you know, just helping you to manage? And then you also talked about the side effects. Can we talk about them so that people know in the event that probably they get vitiligo or they're not on medication and they start medication, then of course they will know these are some of the side effects that is expected.
Yes. There are different classes of drugs that we administer.
Okay.
And they have different
Side effects. Okay.
And those ones, they will be elaborated to you very well by your doctor. But in this case, I'll just bring it generally. Sometimes you might develop, of course, I talked about the loose, the itchy skin. Sometimes you have the reddening of the skin because of the dilation of the vessels. The blood vessels will dilate. Okay. Sometimes also those drugs, they cause nausea. So you might also be nauseated, feel like vomiting. Sometimes the same drugs bring, you know, because they are meant depending on what really has caused. It's wide. It's a very wide scope of it. So depending on what really caused, then that drug which has been applied, if it's a genetic thing, then there is a way it manifests. If at all it is the diabetes that has also led to that, no, the thyroid is the thyroid aspect. It comes out differently. So for those who want to treat this case, those who want to use the drugs, please go on and use. If you can use the drugs, but the side effects you may not really escape from them. Vomiting, I've also mentioned, because that's now, they affect other systems in the process of trying to manage this other. Okay. However, let me mention something interesting on that. You realize you might have really put a lot of focus on that. You really want the treatment, but it cannot happen. Well, there is God. There is always hope. True. There is God, and I have lived to see miracles. I've seen, like the other day I had of, and I witnessed of a uterus that had not been there, but then after the Lord's intervention, okay, then this person had a uterus. Okay, so it's possible, nothing is hard. Yeah. So you always have hope that also one time you can get out of it. However, the treatment has also the consequences accompanied. And allow me to just add something also concerning there is also the expensive treatment that you can come in with. So the expensive treatment is at another level because if you cannot afford, then you may not. But if you afford it, there is the transplant, the surgery, and also some use of some machines which also produce the UV blue light and all that, so that you try to balance the tone and change, and also initiate the production of melanin. And also, just to mention, sometimes just exposure to the sun can help you heal. All right. So that, yes. Okay, how is that possible? Because we talked about the fact that, of course, overexposure to the sun might cause. Yes. All right. So how is it possible that you like exposure to the sun can help you heal? Here we are talking about probabilities and possibilities. All right. So based on what really has triggered. If now the sun is not
Or
on
if
your
the
side,
sun is not the
please
trigger,
just,
okay.
yeah, if it's not, it's not the triggering factor, then, you know, somehow it might be the one that will bring the solution to your issue. But because to some people, the sun rays, they also, you know, it has effect on the the pigmentation of the skin. Many a times you'll see the melanin. So it depends with the physiology that is the physiology of the melanin.
Okay.
The melanocytes.
Okay.
Yes, please.
All right. Now, what are some of the complications that are... wait, before we even talk about the complications, can we talk about the transplant? Now I'm interested. The melanocyte transplant. So do you get it from, let's say, a member of your family, or where do you get it before you transplant it to someone with vitiligo? Or you get it from that person, but now from a different part of the body? How does that work?
They are picked as stem cells. You get it from someone who is normal.
All right.
And especially those with whom your genetic makeup is compatible.
All right.
So that they can hypertrophy, and then, you know, in the process, it can come out. So your skin will change. But that is still under research.
Okay.
So it's not yet. But as soon as it's out, however, it's not really important to, because, you know, there are some people who are also normal and they want to change the skin tone.
True.
Okay, it's really not important for you to go and, because you might bring yourself more trouble. Anyway, God created you the way you are, so it's good to maintain. But on managing the vitiligo, you can always use the transplant when it will be ready.
All right, I think this person missed when we talked about some of the medicines that one might be given in terms of just helping them manage, and they're asking which medicine can be taken for prevention.
Or the management and the drugs. I mentioned earlier that there are corticosteroids. There are also other drugs. I also talked about the photochemical, because we use the light rays, which also initiate the physiological processes that will help the melanocytes to produce the melanin, so that it brings the pigmentation. But I mentioned that there are side effects.
Okay.
So as you enroll, there are side effects.
All right. Okay, we need to end the show right now. So thank you so much, Geoffrey, for coming by, Dr. Geoffrey, for coming by today, and of course helping us understand more on vitiligo. And thank you as well for staying with us. And of course, we'll see you, tomorrow for another episode of My Doctor. But for now, it's a goodbye from us. God bless. We'll see you tomorrow.